Hi everyone, it's Dr. Frankie here. I am the Health Expert Ambassador for FemFresh, and in this video I'm going to bust some of the myths surrounding UTIs. So a UTI is a urinary tract infection, and most of you watching this will be familiar with that feeling that a UTI is brewing. It usually comes on in the middle of the night and it can cause so much pain that you're in complete despair that you find yourself scrolling on the internet looking for a solution whilst you wait for the doctors to open in the morning. And during that scrolling, you'll probably come across quite a lot of advice on the internet. So I'm going to bust whether that is fact or fiction. So a urinary tract infection is an infection of the bladder or the urethra, which is the tube that leads from the external opening up to the bladder. And it leads to inflammation of the bladder, which is called cystitis. And that is that feeling of kind of lower abdominal pain that feels really irritated. Now, a urinary tract infection can be caused by bacteria, which is usually E. coli bacteria from the back passage, or it can actually just be isolated inflammation without an infection, which is slightly different. It's called cystitis. But both kind of present the same, whether it's an infective cause or an irritation cause. So as I mentioned, a urinary tract infection usually happens when some bacteria from our bowel can track up into the urethral opening and up towards the bladder, whereas cystitis, which is the inflammation and irritation, can happen due to friction, for example, having sex on a full bladder. But there are lots of other causes for that too. So common symptoms of a urinary tract infection are increased urinary frequency, so needing to go and pass a wee more often than normal. And often you'll be faced with just passing a few drops of urine, even though it feels like you've got a really full bladder. That's because of the irritation of the bladder lining. You might also find that when you do pass urine, it's really painful, it's really burning or stinging, or you get some lower abdominal pain. Another symptom can be a fever, and that can make you feel really lethargic and make you feel really rotten. Sometimes you may also experience some blood in the urine, which can be normal, but that should prompt you to speak to a doctor. Sometimes the urine you pass may look cloudy, or it might smell different to usual, and sometimes you can have some lower abdominal pain. If you start to experience a really high fever or back pain, it can be a sign that the infection is tracking higher up in your urinary tract, and that's definitely an indication to seek medical attention. So getting on to the myths surrounding UTIs. First one is that only women can experience UTIs. This isn't true. It is much more common in women, and that's because the urethra, so the tube that connects the bladder to the external opening, is much shorter in women. So if bacteria is going to backtrack up into the bladder, it's got a shorter journey to go than men, and therefore it's more common in women. Also, our urethra is more close to our back passage, which again kind of increases the likelihood that some bacteria can backtrack into the bladder. But men certainly can get UTIs, and if a man is to experience a UTI, then they should go and speak to their doctor. Myth number 2 is that drinking cranberry juice or taking cranberry supplements can cure a UTI. Lots of people do turn to cranberry-based products to try and help speed up excreting the UTI, but there's actually no scientific evidence it helps. People might tell you it helps them, and that's what we call anecdotal evidence, but in the literature, there's nothing to say that cranberry juice actually speeds up or stops you getting a UTI. The theory behind this is that cranberry juice can contain a chemical which stops the UTI sticking to the bladder wall, and that's where the theory comes from, but it's never actually been proved in the literature before. What I would say is that the principle of drinking more, so whether that be cranberry juice or water, would help flush out the UTI. So I suppose that some truth to it is that drinking more fluids can help speed up your UTI. The third myth is that a UTI is caused by sex. I'd say that sex probably increases the likelihood of you developing a UTI because there's friction. Sometimes if you don't wee after sex, then some of the bacteria can backtrack up into the bladder. But a UTI is not a sexually transmitted infection. So whilst it's more common in people who are sexually active for the reasons I've mentioned, it isn't a sexually transmitted infection. So an STI is very different from a UTI. And whilst we're on that point, some sexually transmitted infections can present very similarly to a urinary tract infection. So if your symptoms last longer than a couple of days or don't clear up with standard treatment, then it's definitely worth getting a sexually transmitted infection or an STI check. So what to do if you have a UTI? Stay hydrated, try and flush out all of the bacteria. You can take some simple analgesics like paracetamol or ibuprofen for the pain, and that might also help the fever. A hot water bottle may help. Some urinary tract infections won't go away on their own, and you might need to speak to a GP and get some antibiotics to clear it. And give yourself a little TLC, so plenty of rest, plenty of fluids, and also the vulva and vaginal area might be a bit more inflamed and irritated if you have a urinary tract infection. So you want to be kind and gentle to the skin around around the vulva and vagina when you have a UTI, because it might be a bit irritated from passing urine so often. As mentioned previously, you only want to be cleansing your vulva and vagina once a day maximum. You can use either warm water, or if you prefer, something like the FemFresh Soothing Wash is really gentle and pH balanced, so if you are feeling a little bit more irritated and inflamed down there, then this will be gentle and kind to the skin. And remember to speak to your GP if the symptoms last longer than a couple of days, if you have got a really bad fever, particularly if you're vomiting or you have the shakes or you get back pain, if you pass blood, if you're getting UTIs often, if it doesn't respond to antibiotics, or if you're a man or pregnant, then I would recommend speaking to your GP. I hope you found this video useful. My name's Dr. Frankie, I'm the FemFresh Health Expert Ambassador, and if you have any questions, feel free to drop me a comment in the comment box below, and I'll see you in the next video. Bye now.